Hi, it's Dr. Erin from the KMC University Help Desk. We're coming in today to talk about an issue that's come up multiple times with our one-on-one clients. It has to do with ChiroTouch, but it's something to keep in mind for any EHR system. We're seeing a lot of doctors creating provider profiles inside of ChiroTouch for their chiropractic assistants or their CAs. And they're usually doing this so that the CA can input information. For example, setting up an exam for a new patient. And as innocent as this may seem, it's actually a big problem. So, unless that staff member happens to be a licensed healthcare provider, they cannot be listed as a provider inside of ChiroTouch. The provider designation is for the chiropractor or for any other licensed professional that you have within your practice. Instead, ChiroTouch has a special feature called Scribe. That is what you should set up to allow your CA or any other staff member who's not a licensed professional to input data for you. Remember, the provider or the doctor, perhaps you have a nurse practitioner in your office, but the provider is ultimately the one that has to sign off on the record. So everything has to be put underneath the provider's name regarding recommendations or therapies performed, because it's the responsibility of that provider to be overseeing all the care in the office. Therefore, you need to be the only provider on the note if you are the only chiropractor in the office. And you're also the only one that can complete that note at the end of the day. So if you have questions, please let us know, or you can always reach out to ChiroTouch directly. They're more than happy to help you set up that scribe feature and show you how to use it in your office. It's really, really quite easy. If you like this content, follow KMC University for more practice tips and tricks. We are your chiropractic reimbursement and compliance experts.